Thank you very much, and good afternoon to everybody. I'm very pleased to be with you and exploring the social, emotional, and general the cognitive impact of digital devices on minors' health. I'm a medical doctor. I work a lot in prevention, and I do a lot of public health work and programs in my country, in Italy. And one of the priorities nowadays in the field of public health is to protect kids from the major impact that the use of personal digital devices and the use of personal smartphones have had on their lives. I want to bring you into the family lives. It is how a mother has explained the problem she had as a mother with her kids once smartphones have been entering into their lives. Life as a mother has become a war since digital devices have entered children's lives. I would have never wanted them before 13, but we were unable to resist our preteen's demands for approval. The day became a marathon between mobile phones and PCs, parental control and family links, a back and forth between changing limits to search for school scheming to increase exposure times. It feels like living with a drug addict. And this hurts me a lot, as well as growing anger towards the outside world and towards a society I'm beginning to detest. We parents are alone, while our children are continuously violated before our eyes. These manipulative rules, strategies, and deceitfulness is exhausting for everyone. Psychological support is needed for the whole family because sometimes there are children in the home who struggle more than others and are more prone to addiction. Unfortunately, this is what it is all about, digital drugs, and we should talk about it in these terms without hiding. We have withdrawal crises and violent outbursts of rage at times. How do we do it? It becomes a huge task to manage. Excuse the outburst of a mother who has been struggling and seeking advice and solution for 3 years, trying everything. I often regret the day when mobile phones, console, and PCs came into the house for my children. With the experience I have today, I will resist it with all my heart. Why is this narration is so important? Because you find a mother who is trying to give rules and to provide the correct digital education their kids need. But this digital education is not enough to protect them from the addiction the devices produce on children's lives. That was what you read in the words of this mom is a quantitative problem of personal digital devices into children's lives. But as a psychotherapist, as a medical doctor working with kids, we, in the last 15 years, we have been dealing with major behavioral problems like sexting, internet gaming disorders, online sex and porn abuse and addiction, hating online, grooming online, revenge porn. These problems have been entering into the children's lives as much as into adults' life, but the problem we have is something like pornography, which is forbidden to minors who are not 18 years old, is nowadays pandemic among preteens, and they cannot protect themselves because they are very explorative. They are very curious to explore sexuality. And in pornography, there are no limits on the basis of your age. This is the book we have been writing for Italian parents, forbidden to the minors who are not 14 years old. This is an association in the United States, Wait Until Haste, and this association and this book is witnessing a movement of parents nowadays who are trying to create awareness among adults, parents, and educators to stop the precocious entrance of kids and preteens into online lives, especially by blocking the possession of a personal smartphone in the lives of children before they are 14 years old. In my book, I describe to parents 10 major areas that are affecting children's health, and research nowadays gives us evidence of how much problematic is the presence of digital devices into kids' lives. 10 years ago, we were not having this clinical and behavioral evidence of problems impacting children's health, because the children were just entering into the digital world with a smartphone. The whole world converted from cell phone to smartphones during the first years of the second decade of the 21st century. So around 2012, everybody was having a smartphone and living a cell phone. What we know is that smartphone is very dangerous for children's health, because make children entering the online world, and the online world does not respond to the principle of stage specificity, giving the kids the right things in the right moment when they are ready to cope with the complexity of that experience and of that kind of stimuli. We know that the online world reduces the likelihood of academic success, and before you possess the earlier you possess a smartphone, the worse your academic success will be before 14 years old. The online world interferes with the normal development of the mind, and we give you some evidence taken from neurosciences. The online world has an impact on physical health of kids. They are not playing, they are not moving outside, making sports, getting out in the natural setting, and this promotes overweight and obesity. The online world reduces empathic skills, and the mirror neurons of our kids are not trained to make the kid becoming empathic. The online world promotes emotional dysregulation. As a child psychotherapist, I can tell you that we have a lot of problems with preteens having troubles in coping with rage, and they have explosive attacks of rage. We have a major problem with anxiety and addiction. If you are familiar with the book by Jonathan Haidt, you will know that he has stated that nowadays adolescents can be considered the anxious generation. It's a generation with the worst indicators of, with the worst mental health indicators among the population of adolescents of the last 50 years. Online world generates sexual diseducation, interferes with the need for sleep. Nowadays, adolescents have lost 1 or 2 hours a day of sleeping time compared with adolescents living 20, 30, and 40 years ago. And many parents are using smartphones to improve their feeling of protection. Possessing a smartphone, if you are a kid, does not increase your protection into the world, into the outside world. As you see, these kind of topics and the evidence of research has brought governments to make a major change with laws, major intervention in the public health field. In Australia, a new law is banning children under 16 from social media. In Albania, right now, a TikTok ban was promoted by Prime Minister, and it was not a rush reaction to a single incident, as it was said all over the world when discussing what was going on in Albania. I want you to go out and reach this document. Social Media and Youth Mental Health is downloadable and is free of charge, and you can get through any kind of if you make a research with this title, is a public statement drawing the attention of the American people to an urgent public health problem and providing a recommendation on how to address it. It was written by the General Surgeon in the United States, and the General Surgeon is the head of the Public Health Service and spokesman for public health issues within the federal government. And in this document, what is stated is that the use of social media in the adolescent population is now almost universal. While social media also provide benefits to the lives of those growing up, it presents a significant risk of harm to the health of adolescents. We cannot claim that social media is a safe environment for the health of minors, and immediate action must be taken to make social media safer territory for those growing up. There are many data in this report you can consult, giving you the evidence why social media are a public health problem. And nowadays, this change, in the beginning, it was considered an educational problem, which had to be considered and planned by parents. But with the clinical data we have, with the behavioral data we have nowadays, social media are becoming a public health problem. And we are urging governments to promote laws to protect minors from their precocious involvement into social media. Social media may perpetuate body dissatisfaction, disordered eating behaviors, social comparison, and low self-esteem, especially among adolescent girls. When asked about the impact of social media on their body image, 46% of adolescents aged 13 to 17 said social media makes them feel worse. 40% said it makes them feel neither better nor worse, and only 14% said it makes them feel better. And roughly 2/3 of adolescents, 64%, are often or sometimes exposed to hate-based content. Right now, I want you to, after I brought you into the family life narrated by a mom, after I brought you into some of the data we have from epidemiological studies, behavioral studies, and clinical studies, I want you to bring into the brain of a pre-teen, a pre-adolescent. I want you to know what happens to the mind of pre-adolescent and why, especially pre-adolescents, the age between 10 and 14 is especially vulnerable to the effects and the impact of online experiences. Just make a check about our brain functioning is organized. Neuroscience has shed light on the structure of the brain and its development during growth and how these developmental changes profoundly affect behavior. Imagine that the brain is like a three-story house. The ground floor is the most ancient part of our brain, is the reptilian brain, and we find also function associated with survival, a kind of control unit that is activated whenever survival is at risk. And the ground floor is not impacted by what we do in our online lives. But the first floor is the emotional brain. The emotional brain is very vulnerable to what is going on in the online life, especially if you are a preteen or a child. In the emotional brain, the information related to what we feel is processed. Pain and pleasure, joy and sadness, anger and fear are all regulated in this area. The emotional brain feels life and is looking for instant gratification, excitement, and pleasure. And the emotional brain does not like frustration, does not like boring, does not like cognitive efforts. So if you enter into a video game, you will find a perfect harvest for your emotional brain. And the emotional brain does not like a lot entering into books. If you are 12 years old and you have to study history or geography, and you have your Fortnite console or video games console, on the other hand, your emotional brain drives you to use your video game and to forget to study your history books. With what part of your brain you study history, geography, or read books is the cognitive brain. The cognitive brain is the gray matters of our brain, and we are the only living beings having cognitive functions and cognitive brain. In the cognitive brain, we have the ability to produce thought, to reflect on actions, to predict the consequences of what we do or might do. And we produce language with our cognitive brain. So what's the problem? What neuroscientists told us? Neuroscientists have discovered what happens to the human brain during childhood and adolescence. We now understand why, especially in pre-adolescence and early adolescence, young people indulge in sensation-seeking behavior such as those available online. In fact, during childhood, pre-adolescence, and adolescence, the brain is much more developed in its limbic area, the emotional brain, while it is still immature in its prefrontal cortex area, which is the cognitive brain. Often among minors, consequently, the emotional brain takes control of the situation, leaving the individual unable to act with the mediation and regulation role played by the prefrontal cortex cognitive process. The prefrontal cortex area is a decision-making part of the brain responsible for the child's ability to plan and think about the consequences of action, solve problems, and control impulses. Changes in this part of the brain continue into early adulthood, but changes in this part of the brain are not so evident between 10 and 14 years old, while changes in the emotional part of the brain are very evident between 10 and 14 years old. So imagine the brain of a preteen boy and girl. If you look out for blue and violet areas of the brain, those blue and violet areas are cognitive mature areas. The first brain is a 5-year-old brain. The second brain is a pre-adolescent brain. The third brain is a 16 years old brain. The last brain is a 20 years old brain. The fourth brain is all blue and violet. It's all mature under the cognitive point of view. The first brain, the 5 years old brain, is all red and yellow. Red and yellow means no cognitive maturity. Now check out the second brain. It's a brain for boys and girls between 10 and 14. You don't find a lot of maturation. There is no more blue and violet compared with the first brain. And if you check out the square, the white square box, that's prefrontal cortex, is the area we have here under our frontal area. This area is the cortical area where we have our most developed and most sophisticated cognitive processes. We regulate our emotions with our prefrontal cortex. We can tolerate frustration, and we can go through boring situation, knowing how to cope with them. But if you watch the prefrontal cortex in the second brain, you see that it's all red and yellow, and there is no blue and violet. So the cognitive brain is still very immature during pre-adolescence, while if you go into the emotional brain accelerates a lot very quickly and become very powerful. So between 10 and 14, the brain in a preteen boy or girl is under the control of the emotional brain, pushing the boy and the girl to have excitement, to look for instant gratification, and not being very able to self-regulate the behaviors of the young boy and girl and to direct it to more complex cognitive functions. The child and adolescent brain finds it very difficult to integrate messages coming from its limbic area, the emotional brain, that is very sensitive to social and emotional stimuli, such as those dealing with sexuality, excitement, and arousal, with those coming from the prefrontal cortex, where most of the cognitive processes occur, aiming at decision-making, problem-solving, and critical thinking. So prevention must provide young people with the skills to use and integrate both sides of the brain, emotional and cognitive, in a cooperative and proactive way, while what they do in their online lives dissociates the functions of the emotional brain and the cognitive brain. When you enter into pornography, when you enter into a video game, when you enter into a social media platform, you are hooked on your emotional brain. Your emotional brain does not integrate with cognitive functions, and you are under the control of your emotional brain. This is very problematic for our young boys and girls because they keep on doing a lot of instant gratification activities, dopaminergic activities, and they are kept far from school duties, involvement in more positive and enhancing activities. So what you see, there is a lot of sensation seeking in the online world, and that sensation seeking makes them doing a lot of risk taking activities like extreme challenges. These are this is the chemistry of happiness inside our brain. You can feel happiness thanks to dopamine, instant gratification, thanks to oxytocin, social relationship. Oxytocin happiness is based on social relationships. You can find the happiness thanks to serotonin. It's based on having physical activities, running and walking into the nature. Serotonin helps you to stabilize your feelings and your emotion. And you can feel better also with endorphin, which are the pain killers. When you are feeling pain, your brain produces endorphins, and the level of pain into your brain decreases. But true happiness, especially during adolescence, is based on activities that activities that make your brain produce oxytocin and serotonin. Right now, we have a million of young kids looking for happiness induced by the production of dopamine. And this is very problematic because they are looking more and more for instant gratification. And instant gratification is the major enemy of education and maturation of the cognitive functions during growing up. As Jean Twenger wrote, if an activity involves the screen, it's linked to less happiness and more depression. If it doesn't, particularly if it involves in-person social interaction or exercise, it's linked to more happiness and less depression. If you enter into this book, The Anxious Generation, you will have evidence of whatever I was trying to explain you. Jonathan Haidt has been very, very successful in explaining why adolescents nowadays have so low mental health indicators, why they are suffering so much of anxiety, depression, and self-lesionism behaviors. The problem was deprivation, sleep deprivation, social deprivation, limitation of the cognitive functioning during developmental age, and addiction. And the combination of these four dimensions into the life of young kids due to the fact that they have been possessing a smartphone, introducing them to online lives very early in their childhood, has been the main reason related with the mental health emergency we are facing right now. I stop, and if you have questions, I'm here for you.
Thank you, Mr. Pellai. I don't see any question in the chat.
Yeah, it's not really a question. It's just an observation that as a child I was very, very into sports, hours every day, and it brings a clarity of the mind and a possibility for a young person to really absorb education at school. So I trained a lot when I was a child, while at home and also at school during lunch breaks and all the breaks. And there's nothing like the happiness entering into a math lesson, clear of mind and with a hot body. It's just incredible how important physical activity is to the ability of the brain to absorb knowledge. It was just in agreement to your good advices here. Thank you.
Yes, your comment is very important. During developmental age, we have to create the better balance possible between body and mind, and body is a big support for mind functioning. One of the problems we have right now is that growing up is disembodied, is not attached with body activities and body functions. And if you are a child and preteens and you do a lot of activities that do not involve your body is suffering, but also your mind is suffering.
Okay, we have now a question. One more political I skipped. The other is by Margaret that in different attempts says the different wiring than the brains before this came into play. So do you speak, do you expect a permanent rewire of the brain?
Okay, so the first question, why don't governments warn against social media in the age of 10, 14s? They are just in the process of trying to do it. But at the same time, we have that the big interest, the big money involved in changing rules and policies dealing with social media platforms. Restrain governments from promoting laws protecting young kids. This is exactly what has been happening with tobacco industry. We have been able in the public health field to declare that tobacco was a conclamated risk factor for health of human beings only in 1982, after millions of deaths and diseases had been produced. And right now, public health specialists are trying to work with governments to protect the mental health of kids, children, and adolescents. But at the same time, there is so much work contrasting this approach and trying to convince people that social media are friends of teenagers and preteens. Social media make young people socialize and are the way of socializing needed by kids in the third millennium. But as the second question asked by Margaret, there is now we have clinical data, behavioral data, and neuroscience data. And there is a rewire of the brain during childhood and adolescence, which is the subtitle of the book by Jonathan Haidt. His book, The Anxious Generation, Why Smartphones and Social Media Are Rewiring the Brain of Our Children. This is a concept in his book. And neuroscience show us that the way wire neurons and connect neurons into the brain in the digital generation, in Generation Z, is completely different from what has been happening for the previous generation. So this rewiring right now is very problematic, and using neurosciences, we will be changing the approach to the problem. In Italy, right now, we have been launching with Daniele Novara a petition to our government, which that has been signed by almost 1,100 people in Italy, and this movement is really going around the whole world. So every country should have a movement of parents trying to change the rules and the law into their country.